Hi, I'm Dr. Andrea Labuti, and today we're going to talk about meltdowns in autism, specifically self-injurious behavior or self-harm. Now, this is a really important topic because it can be so excruciating to have a child that is hurting themselves, and it's really important to understand why they're doing what they're doing, and it's not always easy to figure it out. But we're going to cover three potential reasons. The first is pain, the second is being overwhelmed emotionally, and the third is being overwhelmed environmentally. And I'll talk about why those things are important and how you can be a bit of a detective to figure out what's exactly going on with your child. So let's talk about pain. This is really important. I had a client when I had a private practice, that was 10 years old at the time, a nonverbal boy, and he would frequently headbang, and it was so distressing to the mother. She had no idea what was going on until fast forward 6 years when the child learned RPM, which is rapid prompting method, and he now can have conversations using this methodology regularly, which is great. But his mother asked him, "Why did you used to bang your head?" And he told her, "I had a lot of pain, Mom. I had a lot of pain." So, unfortunately, we don't know if the child is in pain or it's something else. But here's what you can do: think about talking to your doctor and exploring the possibility. I think this is a really good idea no matter what. The possibility of maybe having some imaging studies done, like an MRI or like a functional MRI or an MRI, or some EEG studies to see if there's epileptic activity or something going on that's causing the pain. That would be the first thing I would do. The second thing I would do is, people hate to think about this, but food can definitely affect our bodies, especially in our kids, because they're so sensitive. I know plenty of adults that have migraine headaches that are triggered by food, by certain kinds of food. So you're going to have to try an elimination diet, right? Get rid of all of the usual suspects, dyes, processed things, artificial things, MSG, that's a big one. Any of those artificial sweeteners, for sure. And as long as all of those things are out of your child's diet, if it's still happening, then think about gluten and dairy and corn and soy. Those are very pro-inflammatory, so it's worthwhile trying an elimination diet for pain. The other second item that would be a cause for self-harm is emotional overwhelm. So think about being trapped in a body in a child that can't really express him or herself very well. Either they're nonverbal or minimally verbal, or they just can't get their emotions out. They're not used to talking to their emotions. If they do talking about their emotions, if they do talk. So think about finding a way again of asking your child to help you understand what's going on. Like, what are they upset about? And, there is actually something that ABA does, and I'm not a fan of ABA. I'm a fan of really good teachers and really good therapists, but ABA not so much. But they do have this what's it called, like a program. It's not really a program, it's a checklist. It's called ABC, and it stands for antecedent, behavior, and consequences. So when a child is having a a meltdown or a head banging or some sort of self-injurious behavior, you want to be a bit of a detective. Like, what's going on right before they do that behavior? What's the environment like? Who are the people around them? What could possibly be going on that's causing the behavior? And then on the other side of that is consequences. So sometimes behaviors happen because someone's trying to get out of something or trying to shift something in their environment. So think about that too. So think about the ABCs: antecedent, behavior, and consequences, when you're trying to figure out what's going on with this particular behavior. And then the environment, the third thing is the environment. That's really important to think about, because there are so many things that autistic kids are heightened to. Their senses are really heightened. So for example, the fluorescent lights could be extremely detrimental to your child. The sounds or smells or even the vibe in the room I know that's sort of out there, but the vibe is really important. Who are the people that are around your child? Is your child purely frustrated because the teachers and people that are with them don't believe in your child and they think that your child is not capable? Maybe they talk in front of your child about your child. So you have to think about all those things. Headbanging and self-injurious behavior is um, a real excruciating problem, and you really want to try to get to the bottom of it. And doing some of these things should help. Um, there's no reason that you can't do a full exploration of medical things that could be going on, then food, and then environment. So if you think about that, and then again, people. So when you think emotional, think about people around your child. So I hope this helps. I know it's a really tough subject, but the bottom line is you have to try to understand what's going on. You have to be a detective. You have to get to the bottom of it, because your child obviously is trying to communicate something to you. Something is going on that's not balanced. So I hope this helps. Please join me at AndreaLabuti.com. Lots of free downloads and PDFs and checklists and things there. I hope it helps. I would love for you to be a part of our community of people that are changing the autism paradigm. We're really trying to get in and understand these kids. So I appreciate your time being here.